Well, every year, nearly 5 million people in the U.S. seek medical care for a traumatic brain injury. Now, based on a mountain of data and years of research, a team of international experts has identified a more precise way to diagnose and treat the trauma. Ann Makovic on the new criteria released just hours ago.
Sean Sanford of San Francisco writes fiction and music reviews. He's a substitute teacher and right now is getting his master's in creative writing. He also really loves skateboarding. 8 years ago, Sean was about to show his friends a new trick.
And then my next memory is laying down, looking at my friends. My wife Candace was standing there and they were asking me if I recognized any of my friends.
Sean had slipped and hit his head on a concrete ledge.
I kept repeating myself and being like, what are we doing? Where are we? Like, what's going on?
At San Francisco General, the clinical guidelines used for decades indicated Sean had a bad concussion that could resolve with rest and time. But then the ER staff scanned his brain and what they saw, he says, saved his life.
Sent me into like the surgery room. They called Dr. Manley, who wasn't working that day. They called him in and they said that they were like, we have a patient who cracked his skull and it's bad, and if he doesn't get treatment, like right now, he's gonna die.
Chief of Neurosurgery at the General and UCSF neurologist Dr. Jeff Manley. He says the current criteria used to assess brain injuries, the clinical symptoms alone, no longer applies.
First of all, it's not very precise.
Manley is part of a coalition of experts and patients from 14 countries who are calling for an overhaul. Trauma centers nationwide will soon begin to test the new approach.
We've been working on this now for over a decade.
The hope? It will lead to more accurate diagnoses, appropriate treatment, and follow-up care.
When somebody's diagnosed as a mild TBI or a concussion, often they're just disregarded. And we know from studies that we've done over the last 10 to 15 years that a number of people that have these so-called mild TBIs, actually, they're not mild at all.
The approach involves clinical exams, biomarker blood tests that measure tissue damage, imaging tests which look for blood clots or bleeding, and modifiers like a patient's age, gender, mental health, even prior head injuries.
We know that it's not just what the injury brings to the patient, but what the patient brings to the injury.
Sean needed follow-up care. After the accident, he developed epilepsy and depression. He now meditates and helps his wife develop relaxation products in their little store.
It's really a place of magic and a place of healing.
And yes, Sean still skateboards, but now always with a helmet.
As for the cost, Dr. Manley expects the new criteria will save patients money by giving them better care, keeping them out of hospitals, and getting them back to work and their families sooner.